So, good afternoon, everyone. Gareth Presh, final session we have today, our final keynote. I am absolutely delighted to welcome Professor Dennis Ostwald, founder, CEO of WifOR from Germany. Dennis and I have been working together for a number of months, putting together some sort of economic modeling around prevention. Dennis is doing pioneering work around the world. And I'm absolutely ecstatic. I mentioned to everyone, all my colleagues today, to make sure you get the final keynote in, because it's so important that we bring the economic metrics behind this. Dennis has been showcasing how this can be done all over the world. And I'm super excited that Dennis is one of our strategic partners. We have a lot of proposals on the table, and I'm very much looking forward to working with Dennis in the future. Dennis, just maybe a short intro, and then whenever you're ready, I can bring up your presentation, and then we can kick off the keynote.
Gareth, thank you for the lovely introduction and this great initiative, this summit, this Global Social Prescription Summit. I followed a couple of previous speakers, and really insightful and valuable topics we discussed here, and I'm really honored to be at the end of this summit to give you some final notes. My name is Dennis Ostwald, as you mentioned. I'm headquartered in Germany. I'm a WifOR Institute, is an international think tank, and now I would like today to inform you a little bit about policies for a sustainable future. I will create or will present to you an economic framework, an impact framework, how you can measure health as an investment. Please start the presentation.
Yep.
Next slide, please. Here you can see WifOR is an international think tank. We have around 75 employees dealing with labor market research, with health economics and health research and sustainability and impacts. Have offices in Germany, but also in colleagues in Greece, Latin America, and the US. And yes, our goal as a research institute is creating evidence. If you measure it, you can shape it, and this on a global scale. Next slide, please. And the presentation is now structured as following. First of all, everyone in our health bubble is talking about the paradigm shift that health is investment. But often I ask myself and my colleagues in the health bubble, why it doesn't happen? Why it isn't happening anything, right? If everyone thinks that health is a smart investment, why do we don't invest more in health? And therefore, I will present to you a three-stage health metrics, where what we developed together with partners, especially Rifat Atun from Harvard University, where we try on a macroeconomic point of view to show how we can measure return on investment. We need to create evidence in a language which people out of the health bubble can understand. And then I will finally conclude my speech and give a brief outlook. Gareth, please, next slide. Here you can see, actually, this was a slide within my PhD thesis. I published my PhD thesis 2008. So close 2 decades, since 2 decades, WifOR and myself, we're trying to foster the paradigm shift in health from a cost factor to a driver of growth, innovation, wealth, prosperity with better health. And lucky we, in the health bubble, we are thinking about these topics. Unfortunately, if it comes to ministers of finance and to the presidents of the world, there's still, in most of the countries, the feeling that health is expensive and is a cost factor. And this is what we need to shift. And therefore, we need metrics. And on the next slide, you can see maybe the biggest achievement in my career. This is our new chancellor. He's now, I think, 10 weeks our chancellor. And 4 weeks ago, he quoted in one of the most important newspapers in Germany, in Die Zeit, when he was asked about the 6 aspects he wants to change, and we made mistakes in the past, he mentioned 1 out of the 6. Healthcare is the fastest growing sector of our economy. we always view healthcare policy as a cost burden, rarely or never as an opportunity to get value in our own country. And that was finally the success of the team, not only of WifOR, but the community, the health bubble here in Germany. And he relies on data we are calculating on behalf of the Ministry of Economical Affairs since 15 years. So that the health economy in Germany contributes close to €500 billion to GDP. That makes up 12%, 12.5% of the total country's economic output. So it's €1 in every €8 in the overall economy. So we are talking about a growing sector which impacts GDP with an average annual growth rate, and it creates jobs. So 7.7 million jobs are related to health investments in Germany, and this is nearly every 6 workers in Germany. Next slide. On the next slide, you can see that it's not only about Germany. Yes, we are headquartered here, but we decided 7-8 years ago that we need to provide toolkits for other regions in the world. This narrative is not only a German or European narrative, it's a global narrative. We need to tackle these topics globally. And so we co-launched now in the G20 presidency of South Africa together with Hatich Beton, my colleague Roberto Duran Fernandez from Tech in Mexico, and Rifat Atun. We published a so-called health taxonomy where we suggest the following aspects. Please, next slide. Where we suggest that every euro invested or dollar invested needs to be measured as a return on investment in 5 categories. So first of all, we need to measure the direct return on investment. Then we need to analyze the interlinkages in the health economy, and this is extremely important if we are talking later about prevention and also prescribing, social prescribing. We need to measure the spillover effects of the health economy because it's not only a sector, but it also affects adjacent sectors, right? So if we have a health production, then we need also suppliers, and the suppliers need suppliers. And in every single other sector, it's very common to report on this kind of spillover effects. And then, even though that in our days, the sustainability topic is not on the top agenda, we see it in the future as a major driver of investing in health, because the healthcare sector is one out of 11 sectors, the third cleanest sector if you invest in it. And this must be taken into consideration as well, especially if you think about climate change and the negative effects on health in the future. We need to provide evidence on this as well. And the last step is the social impact of health investments. And now this is a broader framework, and for the health metrics, we now are thinking about the following 3 steps to simplify it a little bit. First, quantify the economic effects. Second, calculate the social impact of medical innovations, of processes, of interventions, of prevention, of social prescribing. And then it's the most important point, why do we need to measure it? Why do we need this evidence? We need this evidence because we have one problem. And unfortunately, nobody also out of the health bubble is facing this problem. It's not the problem that we can't finance healthcare system. We have the problem that we can't afford future cost of illnesses. And the cost of illnesses describes the future socioeconomic burden to societies. And this we need in the discussion, we really need to take this into account. Coming back to step 1, here you can see that all health investments globally create a GDP of 7.6%. It's twice the GDP of France. The labor force is around 200 million people who are related to health investments globally, which is the entire labor force of US and Canada. If you drill down to Europe, you can see, next slide, you can see that 11% of our wealth in Europe are related to health investments. That's the GDP of Spain and Estonia. 30 million people in Europe are employed due to health investments. This is 14% of the entire labor market. In other words, the entire employment in France. On the next slide, you can see how much this investments in health differ from country to country, right? We see Turkey, it's only investing 4.4% of their wealth in health. Estonia, nearly the double. Brazil invests 9.6% in health and creates 9.7% GDP. So even as a non-economist, it's a no-brainer to invest in health because you're creating one-to-one investment, the return on investment only in economic terms. And the EU is the same. So that means we have a positive return on investment in economic terms, and now we need to think where to invest smarter and when to invest. And this is on the next slide. You can see this is high-level published report in a paper of the Lancet Group, where we did analysis for Commonwealths on only the economic effects of investing in HPV vaccination. And in the UK, if you have an investment of 134 million US dollar in this vaccination, you're creating 1.84, a multiplier of a return on investment of 1.84. In economic terms, we are not talking about the social impact or the impact of human capacity and also the reduction of cost of illnesses in the future. And this analysis is now scaled up to the entire Commonwealth and will be published in 1 or 2 months. This is now the economic part. Now we are coming to the second part, the social impact. And this was, to be honest, I was our former chancellor, Angela Merkel, I was allowed to present her the economic footprint numbers. And the huge numbers about the importance of the health economic sector. And then she asked in the end, Ms. Ostwald, what shall I do? Shall I invest more or less in health? And what does it mean to the society and to my voters? And this was actually the birthday of our thoughts. How can we translate the message of investing in something like prevention, interventions, medical devices, to value to society? And therefore, we need to identify the health benefits based on health technology assessments. Then we translate the health outcomes in socioeconomic benefits on a macroeconomic point of view in terms of productivity, unpaid activities. We monetize it. And with this step, we are creating the macroeconomic numbers that you can announce how high is the return on investment in intervention in GDP categories. And this is the innovative element of this matrix. And we have published more than 50 different interventions in different journals. And if you do so, then you can, in the end, also compare the benefits and the costs in the end. And you can give and create evidence for political decision makers what to do. Next slide, please. On this slide, you can see an example for Japan. It's a drug. And you can see that we can save up 4 million hours per year. This is avoided loss in paid work. It's 2.5 and 1.5 million hours. And this is approximately 120 million euros, dollars GVA per year. And then you can ask, how much is the cost of this drug? And so you open up a different discussion. On the next slide, you can see that we also did an analysis for Korea of early intensified anti-diabetes treatments that can avoid around $23 million in productivity and activity losses over the 10 years. So you can see, and we are happy to collaborate also with ISPOR, that also ISPRO and the scientific community is now starting to think about broader values, taking productivity into account when discussing the benefits of interventions. Next step, the third layer. If you have, you need to describe the problem, and therefore you need to model the socioeconomic burden of diseases. We have the global burden of disease studies of IHME, and this needs to be translated in monetary terms. Why in monetary terms? Because talking about DALIs and QALIs, nobody in the ministries of finance in the world will open an ear for it or open a door for someone who wants to talk about this. But if you translate these numbers in figures like we did for Brazil, where we calculated that 1/3 of the cost of illnesses create, in best case scenario, a damage to the Brazilian GDP of 4.2% of their GDP. And I was allowed to talk to an advisor of President Lula, and it just said, look, let's multiply the 4.2 with 3. Then you're reaching close to 13% of your wealth as on risk of health. And then I said, and you have not even started to manage this risk. And you can manage this risk with prevention or social prescribing or other instruments. Next slide, please. Here are some other aspects for the European Union. We calculated that the cardiovascular diseases generate a social burden of, depending on the scenario, on 4 to 5% of GDP. And I just want to highlight, because in Europe, I'm based in Europe, most of the European countries are suffering with growth rates. Germany is facing maybe the third recession in a row, never ever since 1945. That means we need to find ways how to increase our growth. And if we have damage to our growth via cardiovascular diseases by 4 to 5%, we need to discuss how can we reduce this burden. And if we reduce this burden, we increase our growth potential easily. And so we have great opportunities in different countries to prevent diseases. Next slide, please. And here's one shocking number, and I was really, it's also very high published. On the right corner, only migraine in Germany creates a damage to society close to 2.9% of GDP. And this is because of migraine patients are within the workforce. 2/3 women, 1/3 men. And this affects the economies globally, especially not only in Germany, but also in other countries. And so also migraine is partly, it's possible to prevent migraine. And so this opens new dialogues. Thank you so much for listening to this matrix. And now I want to conclude on the next slide. And this picture I presented 2 years ago at the UNGA, starting with the first picture that health isn't a cost, but a growth, an engine of growth. That's a static narrative. And I thought with my team, how can we create more dynamic elements into it? And the dynamic elements are, we need to start with smart health investments. We need to invest in more innovation, processes, products, structures. Also in investing in social prescribing and prevention. And then we need to figure out and create evidence, what does it mean for better health? Better health creates more productivity. More productivity creates greater wealth. Greater wealth creates more fiscal space. More fiscal space can be partly reinvested in more innovation. And then we got there. We need to start a positive feedback loop by investing in health, creating better health for all of us. And on the last slide, we have some friends now. And I want to quote once again Mr. Merz, but also the new Commonwealth president. She mentioned health spending is not a cost, it is an engine of growth. And Tedros, certainly, he says the time has come for new narratives that sees health not as a cost, but an investment that is the foundation of productive, resilient, and stable economies. Thank you so much for listening to me. I'm looking very, very much forward now to a discussion. And once again, Gareth, thank you so much inviting me and that I was allowed to take the last slot. It's always a great honor and looking very much forward to the discussion.
Oh, no, Dennis, thanks a million. I think it's been a fabulous opportunity for us to kind of, discuss the opportunities here, and you've outlined the business case, and it's great to see the Secretary General, the new Secretary General of the Commonwealth, on the page. She sent a very nice message from our office for the conference. Unfortunately, she couldn't speak today, but we do have that support, and I look forward to being able to engage on that side. But let me just ask a simple question, like, what are the economic benefits, can governments expect from investing in social prescribing and preventative health?
There are, and this is something, Gareth, I want also to share with you and other panel people who are listening to this panel. It's not all about WifOR. We have such a lot of wonderful health economics offices and institutions and NGOs, and the data is on the table. To answer your question, we have a high return on investment in social prescribing and preventive health. There's a study that for every pound invested in social prescribing, the NHS sees up to 3.42 pounds in return. It's published by the UK Department of Health. But now coming back to we have a positive feedback loop. We have the narratives, but I think we are talking to the wrong audiences. We are always convincing ourselves we know about this data, but and I instructed my team, I want to have 5 high-level meetings a month with people who never ever thought about investing in health. Ministers of Labor, Ministers of Finance, association of employers, not talking to the same bubble all the time. And then we need to talk a language they are interested or about topics in a language they are interested in. And if you talk to a Minister of Finance, he needs to have higher growth rates. He needs to have a higher growth pathway. And very simple, I'm also an economist. You need to stimulate 3 aspects if you want to higher growth rates. You need to have technical progress, capital, and labor, labor volume. And in aging societies, the labor volume is decreasing. We can't afford ill people. We need people who can work and work for our welfare, and that's the topic. So the macroeconomic benefits, which governments can expect, they are at the table. But we need to tell the story to people who are don't thinking and listening to these arguments.
And that's actually the purpose of the World Health Innovation Summit. It was to break those barriers, to bring in the patients, the clinicians, the managers, the voluntary sector, education, but most importantly, the business community, people outside the sector, so that they could understand the economic repercussions of all this ill health. For example, in the UK, you talked about the workforce. The workforce in the UK, we have ill health, which is costing the UK government, 2.5 million people at the moment with ill health. It's costing the UK government over 100 billion annually. I think it's about 4% of GDP, like you said.
Yeah.
And these are huge figures. But also you have a diminishing workforce due to ill health, like you said. The numbers are impacting on taxpayers, which then affects your growth.
Yeah, true.
What you outlined. So I think there is a super, like you were mentioning, this metrics of a sort of circular way of redefining growth and investing in prevention. I think there's a real opportunity with social outcome contracts if they're done correctly. And you've seen recently the UK government's £500 million investment fund for vulnerable children and families. I do understand there will be more of them. And that's a vehicle that could go into prevention, propped up initially with private investment, which then can then be paid by results and outcomes in year 2, and then it just rolls. And that would give you that sort of economic metrics that you're talking about. Now, just in terms of the lessons from, what can we learn from countries that have sort of implemented social prescribing into their policy frameworks? I mean, the UK, you gave the example. Can you share some of that?
Yeah, I think what's going on now, I think we need to have cross-sectoral collaborations within the health, I call it health bubble. So or the patient journey or the health journey, we need cross-sectoral collaboration. But if really something should happen, then you need to have the office of the president or the chancellor on board, the minister of finance, minister of economic affairs, and maybe also ministers of labor and education. And they all together with the Ministry of Health need to find ways to implement and it must be somehow not a project, but a mission. What do we want to achieve in the future? And I don't think that we need a lot of money, and we don't need to invest more. We only need to invest smarter.
Yes.
But you need really this a team feeling that this is a way to create better health, greater wealth for the societies, and especially now in Europe and in the geopolitical area, it's a factor of competitiveness.
Yeah. And also we also have to get over the barriers and the mindset that there's no money. I mean, this is something that's so frustrating, because if you go to any financial investor conference, they'll all say there's lots of money. You only have to look at the sovereign wealth funds and the sort of they're hemorrhaging money. But what they don't have is an actual project to invest in, a bankable project. And healthcare can be that driver, and also we also have to look at the leverage within the health sector. You mentioned the numbers of people involved in health, like 30 million or so, across. We have huge numbers in the health sector. I think globally there's over 60 million. But let's look at their pension funds. How can we mobilize just even 1% of that capital? We had an agreement, a statement from all the healthcare providers around climate change. That's very nice. Why don't we take it a step further and mobilize 1% of the pension fund, just 1% towards climate change and climate, that would really move the dial. And like you said, that's not investing a lot more money. All we're doing is just moving the dial. 97% of investments in healthcare is in disease management. Only 3% goes to prevention. So this is an enormous opportunity. I want to start. There's 2 quick questions I have for you, before we wrap up. How do we ensure that health equity and sustainability are central to the future of healthcare reforms? I mean, that's going to be critical.
Yes. So the health equity topic and the sustainability topic is essential. And we need to provide evidence. We need to provide health metrics to show the impact by income, and geography, and to really also take these aspects into account. And you can do it. You can quantify it in economic terms and social terms, and also concerning the social burden and the cost of illnesses. And by the way, unfortunately, often the most the people with the lowest incomes have the highest burden, and produce the highest cost of illnesses. So we will have a higher return on investment if we take care about them. And then we need to invest in long-term resilience, right? And prevention reduces future health costs and supports sustainability of our healthcare systems. And once again, I'm 100% sure we can afford our healthcare systems in the future if we now start to reduce the future cost of illnesses.
Exactly.
Otherwise, we are failing.
And actually, I had that conversation yesterday with a colleague from Finland. We talked about the same issue, and the basically exactly what you're saying. The prevalence of illness and the cost of illness in the future will decimate our economies. But if we invest wisely and do it quickly, this is part of the reason with the World Health Innovation Summit, the Global Social Prescribing is at scale. We've got to do this very large. It can't just be an approach that's done at low, in one city or two city, and let's put no. This has got to go across the patch, and those who adopt this early will reap the rewards very long term. The last question is around convincing decision makers, and I think that's a job for myself and yourself and other colleagues who've joined us today. I think this is about the leadership going forward. I think we have to all get off the fence, and we all have to start to move together more collaboratively out of the silos, and particularly in this space. You're talking about the health bubble. Yes, let's break the health bubble and let's start to immerse ourselves in our communities elsewhere, particularly in the financial sector. That's what I'm looking forward to doing with yourself, Dennis. Just a final word from yourself before we wrap up, because we've just gone over time slightly. Are you optimistic for the future of healthcare, prevention, social prescribing?
100%. Because now it takes time, but I think the evidence, the scientific community did a fantastic job in the past. We have the evidence at the table. Unfortunately, we are not all talking the same narrative to the right audiences and to the right decision makers. Who are the decision makers of investing in health? In the end, in my opinion, the ministers of health, they are just operationalizing what they get forced to do. But we need to find in chancellors like Mr. Merz or presidents of the world who say it's smart to invest in health because it's my future prosperity. I'm 100% convinced that we will have a healthy future together.
And just one of the points I'll make just as we wrap up is important to note that the importance of healthcare on the political spectrum. So I just want to give you some stats and some data here, which gives me very, the encouragement also. In Sweden, 20 odd years ago, the electoral only considered health about 4% of the electoral vote. Okay, that's all that was interested in health. Now it's up at 40%. And I can assure you, as Dennis has outlined, in the next few years, as the burden of disease hits the economy and starts to drag the economy, particularly in the UK as well, because we've got this huge problem, and it'll hit the US at the next term of elections, healthcare will be front and center along with defense. Look, I'm going to wrap this session up. It's been a pleasure, Dennis. Truly delighted that we're working together. The strategic partnership that we have, I'm hoping will bring those fruits to fruition. I want to say thank you to everyone who's joined us today. This has been a fantastic Global Social Prescribing Alliance Summit. We already have the date in the diary. It's the 17th of July next year. You can join us online. We'll be also hosting our Innovation Awards this time next year as well as part of the conference. And we will be obviously deploying Global Social Prescribing Alliance at scale in those areas that WIS is developing city programs with the help of Dennis and other colleagues. So watch that space. I'm just externally really grateful for everyone's support to be able to put this event on today, and look forward to working with everyone in the future. So from myself and Dennis, we'll say goodbye, and it's been a fabulous day. Thanks, everyone.
Thank you so much.